Xerostomia, or dry mouth, Series 11. Saliva plays an essential role in the maintenance of oral pharyngeal health. It serves many functions in the oral and gastrointestinal environment, including oral cleansing, maintaining oral pH balance, protecting the mucosal surfaces from drying out, aiding in swallowing and speech, and enabling taste and digestion. The medical terms often used to describe dry mouth are hyposalivation or xerostomia. In fact, hyposalivation refers to the functional finding of low salivary flow, while xerostomia is actually the symptom that most clients complain about, the sensation of having a dry mouth. Estimates of xerostomia and salivary gland hypofunction are difficult to obtain owing to the limited numbers of epidemiological studies that have been conducted. It has been estimated, however, that approximately 30% of the population 65 years of age and older experience these disorders. Clients with low salivary flow experience many problems, which may include xerostomia, increased soft deposits and dental decay, difficulty clearing foods from the mouth and throat, mucosal soreness, gingivitis, and angular cheilitis, or cracking in the corners of the mouth, fissuring on the dorsal surface of the tongue, salivary duct infections, Candida albicans or yeast infections, difficulty chewing, speaking, and swallowing, burning mouth or tongue, difficulty wearing dentures, halitosis, and impairment of taste sensation. The prevalence of xerostomia is nearly 100% among patients with Sjogren's syndrome. Head and neck radiation for the treatment of cancer causes permanent xerostomia. Xerostomia has been reported in association with menopause and postmenopause. Salivary disorders in the aging population are usually caused by systemic disorders such as diabetes and autoimmune diseases and their treatments. Evidence suggests that salivary glands are vulnerable to the deleterious effects of all of these conditions in elderly people, which may contribute to the increased prevalence of salivary problems with aging. Xerostomia is most commonly experienced as a side effect of medication. There are more than 400 different medications that can cause xerostomatic symptoms. Categories of medications include anticholinergics, anticonvulsants, antidepressants, antiemetics, antihistamines, bronchodilators, decongestants, antihypertensives, anti-inflammatory analgesics, anti-nauseants, antiparkinsonians, antipsychotics, diuretics, muscle relaxants, narcotics, and sedatives. Clients with mental health illnesses are particularly affected by this problem because medications that they are prescribed are often from one or more of these categories. The first step in treating a person with xerostomia is establishing a diagnosis. This often involves an interprofessional team of healthcare practitioners such as nurses, speech-language pathologists, physicians, pharmacists, dentists, dental hygienists, and nutritionists working together to address all facets of the condition. Frequent dental evaluations to assess patients for oral complications is necessary. Teeth and mouth tissues should be brushed at least twice daily with soft toothbrush and a mild flavored toothpaste, and may need to be done more frequently depending on the severity of the condition and the side effects. Consider using special toothpaste for dry mouth. It provides good relief, but it is a little bit more expensive. If foaming is a concern, look for toothpaste with no sodium lauryl sulfate. Health food stores will often sell toothpaste such as Tom's of Maine or the Natural Dentist. A fluoride rinse is often recommended as accelerated rates of decay are associated with xerostomia. Avoid commercial mouthwashes with alcohol, as the alcohol will exacerbate or worsen the condition. Application of mouth moisturizers such as biotin gel to the tongue, soft tissues, and lips can be helpful. However, mouth care should be provided between each application as the gel can build up and may cause malodor. There are many non-pharmacological ways to help reduce the severity of the conditions, including drinking water, sucking on ice chips. Mouth breathing is a significant contributor to the symptom of dry mouth, and since this occurs more frequently when a person is sleeping on their back, encourage residents to sleep on their sides by placing a pillow against the small of the back or one between their knees. Keep the air moist in the sleeping area through the use of a humidifier or something as simple as placing water near the hot air source. For clients with remaining viable salivary gland tissue, stimulation techniques are helpful, such as chewing sugarless gum or sucking on sugarless candies. In conclusion, complaints of a dry mouth or xerostomia and diminished salivary output are common in elderly people as a result of a wide variety of salivary gland disorders, medication use, and medical disorders. Dry mouth problems have a clinically significant deleterious impact on our oral pharyngeal health. Caregivers must be able to identify symptoms, know when and how to ensure a diagnosis is made. Preventive and interventional treatments must be initiated and maintained in order to reduce the impact of these disorders on an older person's quality of life. Thank you.